Oh, that's a red card. Punctured lungs, cleat versus skull, and yeah, that's definitely a red card. Today, we're diving into some of the worst injuries that soccer or international football has ever seen. Let's dive right in. Oh. Oh, take a look at his left knee. Oh. Gets hit on the outside aspect of that left knee, which then torques it medially. Not only do potentially increase the injury rate of the MCL, which is the medial collateral ligament, it also can cause a tear of the medial meniscus as well as an ACL injury. Oh, that's not a good angle. Believe with Ronaldo here, he ended up having partial tear of his MCL where he was able to recover pretty well. This is a very common injury. We see it here in football as well as American football.
From Sanchez, Lionel Messi continuing on.
You just get crowded out here. He found a channel to get into.
He ended up actually straining his groin muscle.
My groin!
The adductors. We have abductors and adductors. So the adductors are the muscles that actually pull the leg in. It's a common muscle that you end up straining, especially in soccer.
So you see him making this run. So there's one there, there's two, and it's just when he runs into Pena then. And then afterwards, it's just out of the camera shot, he smacks the ground as in frustration. Initially, you think it's frustration because he's not got through, but it's more the fact of when he connects there with Pena, the captain.
The most simple way to rehab this per se is to relax at first. Icing is good for like pain relief, but does decrease blood flow to the area, which could prolong healing. You want to compress it down because that'll help with the amount of swelling that gets into that area. Oh, that's a red card. Getting hit in the back of the head, concussion. You can have a counter-coup injury, bruising of the brain, as well as ripping of your ridging veins, which then will cause a subdural hematoma, bleeding to the inner aspect of the skull inside. Could be a medical emergency, could cause nausea, vomiting, disorientation, difficulty with walking, could cause a simple concussion. Concussions, people are complaining of the headache, the nausea, being a little bit off. Majority of the time, we're going to get a CT scan of the head.
Yeah, Mbappé goes to head this ball.
Oh, no.
Hits
Mbappé right to his nose.
Your nose!
Nasal fractures are common. How do you treat it? What do you do? So always remember, pinch your nose and lean forward. Don't lean back, because if you lean back, the blood's going to go to the back of your throat. Not good. Oh, shoulder.
Oh, that's his shoulder.
Ouch. Sometimes in the hospital, we don't necessarily need an image to tell us you have a broken nose, but most people want it. We used to try to reduce the amount of radiation, and majority of the time people who really still want it will tell you that we don't necessarily need it, but again, people want images.
By the way,
He's playing for France at the moment.
we've checked concussion substitutes.
Your nose is really swollen, but it's straight at the moment, and we can see that it's minimally displaced on the image. You're not going to start messing around with that nose because it might heal just perfectly straight. Versus if there's a great deformity where it is like totally sideways, we will reduce it and get it straight as best we can. But all of these cases still need to go to an ear, nose, and throat doctor. Oh, ended up having a horrible ACL tear and meniscus injury. Typically when somebody has an ACL injury, it will cause a loud popping noise. You'll feel it in your body, but sometimes it's even audible because that ligament is really thick.
Pretty thick.
I think it's the left in the first attack.
Ow, he looks like he's in a lot of pain. We'll do what's called the anterior drawer test. We'll actually pull your knee forward, and when your ACL is not intact, that knee will come flying forward. So you'll definitely tell that it is quite unstable. So you actually be able to move it forward and back, which you shouldn't be able to do normally. Oh, the keeper. Keepers are tough. My brother was a goalkeeper. He actually played Division II college soccer and won the national championship twice. Shout out to you, Matt. Good job.
The 25-year-old required medical attention following the collision, but was ultimately forced off in the 22nd minute to be replaced by Mbappé.
Ouch. Pretty bad laceration, which does happen. You see here staples on the face. It has 2 lacerations with a couple puncture wounds to the right side of the face, increase the risk of a maxillary fracture or that sinus fracture underneath, or a orbital wall fracture on that right side. Oh, common injuries to shoulder falls like that, you can have an AC separation, so your acromioclavicular joint, the shoulder like drops down a little bit, so there's a little bit more of a gap. That causes a lot of pain. Treatment ends up being placed in a sling majority of the time. The body will heal on its own. Salah getting pulled down. Oh, by Ramos. Nice. The other component is you can have a shoulder dislocation. The humerus actually slides out of the glenoid fossa, which is where it sits in your shoulder. Okay. Ow, landing right on the shoulder. Boom. People will come to the emergency department as patients and will pop it back in. There are gentle techniques, there are aggressive techniques. You pretty much want to do as gentle technique as possible. What ends up happening is the shoulder's out and the muscles are spasming, and the muscles are what causing the shoulder to stay out or make it difficult to be reduced. Oh, somebody down on the field. Collapsed to the ground, awake, could have had a syncopal episode. So syncope is a medical word for collapsing. And usually it's occurring because of a cardiac arrhythmia or some underlying issue relating to the structure of the heart. Uh-oh. So we see some movement. He's breathing. The issue ends up being, if you do go into cardiac arrest, how much downtime do you have of the lack of oxygen to the brain? So the heart has stopped. We do CPR to beat the heart for an individual. You're doing CPR for about 100 beats per minute. We've been over this before. If you want a refresher, there is a video. We'll leave it in the description below.
Wat is daar gebeurd?
Something's happening. Maybe passed out. Seeing these injuries reminds me, if your body has ever been through wear and tear, you need good sleep to recover. If you need better rest on any level, check out Do Not Disturb by my company Life Happens to help you recover while you sleep. Find it at lifehappens.com or on Amazon.
Mullen collided with Man United goalkeeper Nathan Bishop.
I was at this game. Jen and I were at this game. We saw this happen. Accidental shoulder right into his chest. Causes a pneumothorax with, I think, some rib fractures too. Mullins.
The hospital.
If somebody has a very small pneumothorax, you could put somebody on 15 liters of non-rebreather oxygen and watch and see how they do. Sometimes the air will not leak out anymore and the body will reabsorb the other air and you're okay. But if you're concerned and it's getting bigger, you need to put a chest tube in there. Oh my gosh. Okay, so all these soccer injuries, everybody says soccer players dive, they fake, they're dramatic. Sometimes they try to sell it a little bit too much, but you do have to be careful when playing this sport. It is a little dangerous. If you guys enjoy watching soccer or football, let me know in the comments. Check out this playlist, binge watch everything, and as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.